In this video, I just want to quickly outline what an anterior pelvic tilt and an anterior pelvic sway is, and how these two OP mechanics contribute and exacerbate osteitis pubis. So let's start with an anterior pelvic tilt. So in an ideal world, your pelvis will remain nice and level. And these 2 points here, so this big knob at the back of your pelvis, this knob at the front of your pelvis, they'll remain in a nice straight neutral line. An anterior pelvic tilt occurs that when you're standing and when you're moving, you start to see this line dipping forward. So you have your pubic symphysis here and it dips forward. Now this causes your spine here, which is normally nice and reasonably straight with a slight curve, to develop an excessive curve as it's going up. And that's obviously an issue for your spine and your back because it's going to create extra pressure in your discs of your lower back. But it's also going to create a few issues for your pubic area. As you tip forward, all the pressure is being shunted straight into your pubic bone through here. While it was nice and level and going across, it's now driving straight down into your pubic bone. And of course, this is going to create a shearing effect. It's going to create a lot of pressure on the pubic bone, and it's obviously going to contribute to a lot of the degeneration we see in OP. The other thing that the anterior pelvic tilt is going to do is as your pelvis tilts forward and your spine arches more, it's going to push all your organs in your stomach forward. So you end up seeing a protruding kind of belly posture in people with an anterior pelvic tilt. Now, this is an issue because your six-pack, your rectus abdominis muscle, it attaches right at the front of your pubic bone through here and goes all the way up. So if I push that stomach forward, I'm now pushing and stretching that rec abs. And what you end up happening is this attachment at the pubic bone being yanked forward and stretching and pulling. So now all of a sudden you have all this tension pulling at the pubic bone, and of course this increased tension is going to provide wear and tear, it's going to break down the pubic bone area, and it's going to contribute to your osteitis pubis. Finally, an anterior pelvic tilt, a big part of it is often that your hip flexors have gotten extremely tight. And what you see a lot of the time in osteitis pubis is people complaining of lower abdominal symptoms, and it's these tight hip flexors that are often playing a big role in that lower abdominal pain that you're experiencing when you're coughing or when you sneeze. And it's those hip flexors that are getting extremely tight as they pull this pelvis anteriorly that are causing a lot of those symptoms that you're experiencing. Now, whether it's an anterior pelvic tilt or an anterior pelvic sway, the change in position of your pelvis, forward or forward like this, actually closes down the space in your hip joint. And so what you'll end up doing to try and compensate is you'll actually turn the hip out and you'll turn your foot out to make up for the fact that your pelvis is pushing forward or you're tipping forward. You'll do that. You'll turn the hip out. As you do that, the foot will turn out. And of course, if you're turning out the foot, you're now stretching your adductors. So you're more likely to be walking and running with this turned out foot, and you're going to be stretching your adductors with every single step you take. So whether it's an anterior pelvic tilt or an anterior pelvic sway, you're creating a host of conditions that are essentially going to be exacerbating your osteitis pubis. Hey there. That video was probably really complicated. OP is really complicated. So why don't you let me explain it to you in person? Book in for a free 20-minute Skype consult. I can assess you, tell you what OP is, you can ask me as many questions as you like. We can go into detail about the Skype process and how it works, and we can start working on the things that you need to do to fix your OP and get back to your life. So please, book in for a free session. It's completely obligation free, and let's get started.